Alright, so let's go to Module 10. So we're going to talk about relationships with patients and their family. These are your objectives for the module. So before discussing professional boundaries, let's talk about what's the role of the home care aide. And ultimately the goal is to improve or maintain the health and well-being of our patients. For the patient who's dying, the goal is to assist with end-of-life care and contribute to the well-being or comfort of the patient. And you also contribute greatly to the safe and secure, comfortable home life for your patient. There are certain standards that we have to abide by. For example, if you're in a Medicare certified agency, we must have at least 12 hours of continuing education each year. That ensures that you're up to date on information and possibly updated guidelines. Agencies that are not Medicare certified have different requirements. It's important to know the limitations of the home care aide. For example, you should never administer medications. That's not your role. You have to agree to an assignment outside of what the nurse or agency is assigned for the home care aide to complete. You cannot diagnose or prescribe treatments or medications, so you can't actually tell a patient that they can take a Motrin or a Tylenol for a headache, even though you know it might be okay. You can't tell the patient or family the diagnosis or the medical treatment plan because you are not a licensed medical provider. So let's talk about that relationship. So developing rapport with patients is an important part of your role. Rapport means to the relationship or connection to another person. It includes verbal and nonverbal communication. We'll be working very closely with patients and their families. Therefore, it's important to have a good rapport with each patient, both for the comfort of the patient and so that you, the caregiver, and patient can have a better understanding of each other. It's important that the patient be seen and thought of as an individual. Your patient shouldn't be referred to as my diabetic patient that I'm seeing at noon. Each patient has a name and should not be identified by their medical condition. You wouldn't want to be referred to as that really tall black dude who hangs out with Shanice, would you, Tyler? So remember that your patient is shaped by his or her beliefs, their values, their culture, and their religion. These things combine together to make up a unique person. You should not expect to treat every patient the same, even if they have the same diagnosis. Taking the time to build a positive rapport with each patient will make a huge difference for both the patient and for you, the caregiver. So the National Council of State Boards of Nursing has defined professional boundaries as the limits of the professional relationship that allow for a safe therapeutic connection between the professional and the client or the patient. A professional in this context can be a nurse, a home care aide, or anyone hired or employed to be in a role where there is care being provided to a person receiving the services. In order to establish professional boundaries, the home care aide must present himself or herself in a certain way. Examples of how to establish a professional relationship include a positive attitude, being clean and neatly dressed, following the dress code, being punctual, complete tasks efficiently, and leaving on time. Only do the things that you're assigned to do, and call the supervisor or your nurse if there's things that you're asked to do that you have not been asked to do previously. Being polite. This oftentimes is hard, especially if you've had a bad day. Addressing your patient respectfully. Mrs. Jones always asks how someone would like to be addressed. So when you guys graduate from high school, I will ask you to not call me Miss Russell anymore. That is just professional courtesy. Always explain what you're about to do with or for the patient before you do it. Always practice good care technique, such as hand washing. Listen to your patient and be honest with them. The home care aide's employer also has responsibility in helping caregivers reach high levels of professionalism. Their responsibilities are a written job description, competency testing and skills evaluations, trainings and in-services, appropriate, adequate preparation for each patient, supervision, and supplies to do your job. The home care aide has a unique relationship with working with patients. Being with a patient who's ill or disabled and working closely with both the patient and their family can be a very close and emotional experience for all of us. Sharing in the family's hope, pain, and grief can make us as close to the family or feel like part of the family. It's especially important for us working with a dying patient to maintain professional boundaries at all times. This may be an especially emotional time for the patient and their family. Professional boundaries are established for both home care aides and for the patient. Boundaries protect us from being too involved with our patients. Likewise, they also protect the patient by keeping the patient at a safe emotional distance. When relationships evolve from a healthcare provider and patient relationship into a personal relationship, it subjects both the caregiver and the agency to legal and ethical liabilities. Healthcare professions and professionals or any other helping or caring profession have more specific boundaries, many of which are ethical. Sometimes they're legal. Examples of professional boundaries would include not to engage in outside personal relationship with the patients, remain neutral, do not interfere with a patient's personal relationship, always act in the best interest of the patient. If you find yourself wanting to do something because of your own personal gain, it's best to not do that, and it's best to be removed from that situation. You may never, ever, 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 ever accept a gift or money from a patient. In boundary crossing, a professional may cross a line inadvertently or without really thinking it through. It's not necessarily an intentional cross, but it is a cross of the boundary. So, for example, a home care aide accepts a small gift from a patient. We felt like it was inexpensive and harmless. However, accepting it, the realization is the patient now sees the aide as more than a caregiver. The home care aide now must work to reestablish the boundary so that the patient is clear on their relationship. Another example is a patient's having a really hard time with a boyfriend. The patient's a good listener, so she confides her problems in her patient. The home care aide feels better after talking with her patient and continues to use the patient as her sounding board and goes to the patient for personal advice on a regular basis. There's no longer a clear professional relationship between them. Other examples of boundary crossing: accepting gifts or money, giving patients personal cell phone number or home telephone numbers, visiting with patients when you're not working or assigned to them, befriending the patient or inviting a patient to one's home, inappropriate financial dealings with a patient, discussing one's personal life with a patient, going places with a patient outside of work-related activities, engaging in very close sexual activities with a patient, talking to patients about personal information that has nothing to do with the patient's care, or giving advice, passing judgment onto your patient based on your own personal life situations. So there's times when patients and family members of a patient intentionally or unintentionally cross the boundary, and you're faced with a potentially inappropriate situation. It's important that you, the home care aide, know how to deal with those inappropriate situations. It's important to be direct and clear but not rude with your patient and their family members. And these types of boundary violations need to be reported and discussions need to be held. Certain inappropriate behaviors may be a sign of illness, and so they need to be discussed. It's important that we know how to deal with them and not blame somebody when we cross those lines. So appropriately interacting with patients and their families make a huge difference for all of us.